Your sleeping position isn't random, and it's definitely not just about comfort. Every night, when your consciousness shuts down, your body makes a strategic decision. A decision that affects how efficiently your brain cleans itself, how open your airway stays, how your spine ages, and whether you wake up refreshed or mysteriously exhausted. The average person spends one third of their life sleeping. This is not a waste of time. This is vital for our body, especially our brain, to recover. And tonight we're explaining the six most common sleeping positions, what they actually do to your body, what they quietly optimize, and what they slowly sabotage. Because once you understand the physics of how you sleep, you can stop letting gravity bully your biology. Let's start with the position most humans default to when the lights go out. Side sleeping. Roughly two-thirds of the population ends up here at some point during the night, which already tells us something important. When the brain goes offline, most nervous systems choose the posture that feels safest and most efficient. From a physiological standpoint, side sleeping is a high performer. Your airway stays more open than on your back. Your spine avoids extreme rotation. Your heart doesn't have to fight gravity as aggressively, and your internal organs settle into a layout that actually makes anatomical sense. But the real star here is your brain. While you sleep, your brain activates the glymphatic system, a waste removal network that flushes out metabolic byproducts, like beta amyloid. Studies suggest this system works more efficiently when you sleep on your side because gravity assists fluid movement through brain tissue. Think of it as a nightly pressure wash for your neurons, clearing out the molecular debris that accumulates during your waking hours. In simple terms, side sleeping helps your brain take out the trash. It also reduces snoring for many people by preventing the tongue and soft palate from collapsing backward. Digestion improves. Blood circulation stabilizes. Sleeping on your left side can be very beneficial, especially if you have GERD. This position helps you adapt to gravity and prevents stomach acid from going up into your esophagus. By utilizing the natural curvature of the stomach, you're essentially using physics to prevent chemical irritation. But side sleeping isn't flawless. Extended pressure on one shoulder can compress nerves and restrict blood flow. Hip joints take on asymmetric load, and if your neck isn't properly supported, you wake up feeling like you lost a fight with your pillow. The solution isn't abandoning the position, it's optimizing it. Neutral neck alignment, a pillow between the knees, a spine that stays straight instead of banana-shaped. Do that, and side sleeping becomes one of the most mechanically sound choices your body can make. Now, some side sleepers don't just lie there. They reach. This brings us to the Yearner position. The Yearner is technically a side sleeper, but with arms stretched forward like you're chasing something in a dream or trying to grab an invisible handle. About 10 to 15% of people sleep this way regularly and biomechanically. It's an interesting compromise. You still get the airway benefits of side sleeping. Brain drainage remains efficient. Digestion stays relatively smooth. But extending the arms shifts your center of mass slightly forward, which can relieve pressure on the lower shoulder and chest. For some people, this improves circulation and oxygen delivery, especially during REM sleep. That's one reason yearners often report vivid dreams. But there's a cost. Keeping the arms extended for hours places tension on the brachial plexus, the nerve network running from the neck into the arms. That's how you wake up with numb fingers or an arm that feels like it belongs to someone else. The Yearner also introduces subtle spinal rotation. On a mattress that's too firm or too soft, that twist can irritate the lower back over time. Optimized correctly, though, the Yearner is a solid hybrid. Side sleeping benefits with slightly more chest openness. Quick check-in. If you've already identified your sleep position, drop it in the comments later. I'm genuinely curious and I will read all. All right, let's straighten things out. Why some people think they sleep on their back, but actually don't. The soldier pose. Flat on your back, arms at your sides, legs straight. You look like you're waiting for a system update. Biomechanically, the soldier pose is all about symmetry. When supported correctly, it keeps the head, neck, and spine in neutral alignment. Pressure distributes evenly across joints. Twisting forces drop to nearly zero. For people with chronic back pain, this can feel like relief. For chiropractors, it's almost frame-worthy. But the soldier has a serious enemy: gravity. When you lie flat, gravity pulls the tongue and soft tissues backward. For people with narrow airways, this leads to snoring, or worse, obstructive sleep apnea. Oxygen levels dip. Sleep fragments. You don't remember waking up, but your body does. The soldier also worsens acid reflux in some individuals. Without elevation, stomach acid has a clear path upward, so this position demands precision. Correct pillow height. Lumbar support. A mattress that doesn't sag like a tired hammock. Done right, the soldier pose is excellent for posture. Done wrong, it's a respiratory risk disguised as discipline. Now, let's widen the stance. Back sleeping. This includes the soldier, but also more relaxed variations. Arms slightly out, legs apart, body open. Back sleeping is often described as the ideal position, and that's partially true. It minimizes facial compression, reduces joint stress, and allows for balanced skeletal alignment. Your face gets a break, your shoulders decompress, your spine rests in neutral, assuming your setup is correct. Back sleeping may also support better lymphatic activity when the head and neck are aligned properly. But again, airway stability is the deciding factor. For people with strong airway tone, back sleeping can be restorative. For snorers and apnea sufferers, it can quietly sabotage sleep quality night after night. This is why many sleep specialists recommend positional training like encouraging side sleeping. For people with breathing-related sleep disorders, this position can provide very good quality sleep. Sleeping on your back is powerful, but it's not perfect either. Small errors compound. And then there's the most dramatic version of back sleeping: the Starfish. Arms overhead, legs wide, maximum territory claimed. Only about 5% of people sleep this way, and it requires a high baseline sense of safety. Evolutionarily, spreading yourself out like this would have been a terrible idea unless nothing was hunting you. Physically, the Starfish can reduce joint compression and increase chest expansion. People who overheat at night often prefer it because spreading the limbs increases heat dissipation. But the risks are real. Keeping arms overhead can compress the ulnar nerve, leading to numbness in the hands. Airway collapse risk remains similar to other back sleeping positions. If you share a bed, your partner might be a little uncomfortable. Still, for certain body types, the Starfish can feel liberating. Low movement restriction, minimal pressure points. It's chaotic, but not inherently wrong. Now we arrive at the position most experts quietly wish you'd stop using. Why your body sometimes chooses the worst physiological option. Stomach sleeping, face down, head turned, neck twisted. From a biomechanical perspective, this is the most problematic posture on the list. To breathe, your neck must rotate up to 90 degrees. Hold that position during the day and you'd be in pain within minutes. At night, people hold it for hours. You are essentially subjecting your cervical spine to a marathon of torque. The lower back hyperextends. The diaphragm gets compressed. Lung capacity drops by up to 20%. Over time, this creates neck pain, lower back strain, and accelerated facial asymmetry due to constant compression. So why do people do it? Because stomach sleeping can reduce snoring by pulling the tongue forward instead of backward. For some individuals, especially severe snorers, it feels like relief. It is a trade-off that you can breathe better at the expense of your skeletal integrity. There's also evidence suggesting fewer nightmares in certain PTSD populations, possibly due to the deep pressure sensation against the torso. Psychologically, it feels grounding, contained, safe, but it's a trade-off. Immediate comfort in exchange for long-term strain. If you're a stomach sleeper and refuse to change, there's one rule that matters more than anything else. Lose the thick pillow. Reducing neck rotation is non-negotiable. So, which sleeping position wins? None of them. Your body chooses the position that minimizes immediate stress, pain, breathing difficulty, internal pressure. That choice is adaptive, not random, but understanding the mechanics gives you leverage. A pillow between the knees, better neck support, slight positional tweaks. These small changes can dramatically improve sleep quality without forcing your body into something it hates. Your bedroom shouldn't be a battleground between your mind and your anatomy. If you spend 1/3 of your life sleeping, you might as well do it intelligently. If this breakdown changed how you think about sleep, hit the like button. It tells the algorithm this kind of educational content matters. And subscribe if you want more videos where biology, behavior, and real life collide like this, without the fluff. Now I want to know, which position are you? Drop it in the comments, unless you're a starfish, in which case you've probably already knocked something over. Wishing you more restful and healthy sleep. Cover yourself well and stay healthy.